Okay, good afternoon, everyone. Thanks for joining us as part of our latest Circle seminar, where Professor Shereen Hussein will be talking to us about her work on the emerging live-in care market in the UK and migrant workers' wellbeing, the complex interplay of Brexit and the COVID-19 pandemic. Professor Shereen Hussein is part of our sustainable care team, and she leads on work focused on the impact of Brexit and the delivery of care in the UK. My name is Matt Bennett, and I'm based here at Circle at the University of Sheffield, and I'll be chairing today's session. I'm going to introduce our speaker, Professor Shereen Hussein, and then we're going to give Shereen about 35 to 40 minutes for her talk and for sharing her work and her ideas. So I'm delighted to be able to introduce Professor Shereen Hussein. Shereen Hussein is a Professor of Health and Social Care Policy at the London School of Hygiene and Tropical Medicine. Shereen is an established multidisciplinary professor with extensive social care and health research experience, working primarily with policymakers in the UK and internationally. Her background is in medical demography, statistics, and computer science. Shereen is a co-director of PRUCOM, focusing on health and social care systems and commissioning. Shereen has advised the UK government and parliamentary committees on adult social care issues, particularly the workforce, including wages and immigration policies. Internationally, she has acted as a senior expert for the UN, WHO, the World Bank, UNICEF and UNICEF on long-term care delivery and planning, elder abuse and ageing and dementia policies. Shereen is a visiting professor at the University of Kent, King's College London and the University of Southern Queensland. She has recently established a GCRF-funded research network specific to policy and practice development for healthy ageing in the Middle East and North Africa. And more information about this can be found at www.menora.org. So without further ado, it's my pleasure to introduce Professor Shereen Hussein. Shereen, if you are ready, the virtual floor is yours.
Thank you very much, Matt, for the introduction, and thank you everybody for taking time to attend this session. So today I plan to talk to you a little bit about the emerging live-in care market in the UK, and this is part of our work in the Sustainable Care Project, as Matt has kindly mentioned. So just as a start, I want to give you an overview of this work, of this theme of work. So the Sustainable Care Programme of Work is a large ESRC study that has been led by Professor Yandel and have a number of interlinked themes looking at different angles to do with social care, particularly in home care. The work that I'm leading on is focusing on the contribution of migrant care workers in the UK, particularly at a time of policy shifting. And when we started this work, we came on the backdrop of the Brexit referendum. However, the reality of Brexit only happened recently, basically, when our work is coming to a conclusion. So the whole program of work is finalizing the last final work to be completed towards the end of August this year. I want to thank particularly Dr. Agnes Turnippenny, who is the researcher working with me on this work package, for all her work in terms of conducting the research and supporting me conducting the research and in the analysis. And for this particular presentation, I also want to thank Obat Tudzara, who is a PhD student and an early career researcher working on another work package, but jointly on this work package, for conducting some of the interviews that we are presenting today. So just to give you an idea, the stuff that I'm drawing on in this presentation, analysis and findings. So we have conducted a number of interviews with migrant live-in carers. So we've conducted nearly 30 interviews with migrant workers in general in the UK, but 13 of them were live-in carers. And we did this between 2019 and March 2020. And then obviously we transcribed the interviews and we analyzed them thematically. Along this, we have also conducted 2 rounds of Delphi surveys, and the Delphi survey is a method really to elicit expert opinions about emerging topics with high level of uncertainties. And we thought that this is really important in the context of Brexit, because you know, when we started this work in 2018, it wasn't clear the direction, when this is going to happen and what's exactly going to happen. And we had 2 rounds of these surveys with a selected national stakeholder group of experts across the social care, immigration policy, and also representative of users and carers and migrant communities. The first round, we ran it in February 2019, and the second round was last year, and it coincided with the start of the COVID-19 pandemic. So we also included some collected data on the implications of COVID on the workforce in general, but in particularly in relation to home care. Our you know, responses is quite sound in terms of these types of survey, because we aim for around 30 respondents. So we had 32 at round 1, 28 at the second round, with 10 completing both rounds of the survey. And the response rate is slightly different. So we had a 60% response rate in the first round, but only 45% in the second round. And as I said, the timing was particularly challenging with the start of the pandemic. And along this, we also conducted policy and literature reviews and analysis at different points of time, as well as looking at workforce data, analyzing workforce data, just to understand the trends and changes in migrant care workers' characteristics. So just before we delve into the context of live-in care work, I want to provide viewers with some context of the contribution of migrant to the social care sector, and also what we envisage that Brexit can pose risks. So the reality is that we know in most of the developed world, migrant workers constitute a quite significant proportion of the workforce for different reasons, and because of how social care sector operates in different countries. In England and in the UK, but we refer to the UK, but the majority of data refers to England. Anecdotal research and other small-scale research indicate that it is a similar experience in other nations in the UK. But if we look at the trends of the contribution of migrant workers, we see something really interesting, that we have a significant contribution of migrants at around 18 to 20%, but this contribution is consistent. And that's despite the escalating demand and the expansion of the sector and other factors. So the reality is that we require a certain number and a certain proportion of migrant workers to contribute. And the other thing that is not shown here in that graph is the geographical diversity. So we know that this share is quite, even more significant in large cities, and particularly in London, in the capital. But increasingly as well, we see that they have a higher contribution in certain settings, and relevant to this, the increased live-in concept. If we look at the other shades of the green, that shows you the share of EU and non-EU nationals in this workforce, and that's important because we're talking about Brexit. And what you can see that although the consistent share remains, the share remains consistent, the profile is shifting from non-EU migrants to EU migrants, and that reflects and mirrors the immigration policies that has been going through, the UK has been going through it. For example, in 2004, the expansion of the EU, the inclusion of the E8 countries. And then further in 2010, when there was a cap on non-EU migrants, etc., and the removal, and again putting it back, the senior care worker as a shortage occupation. So what are the Brexit risks then when we have this picture? And these came from the Delphi survey of experts, and the major risk that comes out is the supply of workers. So it's clear for all stakeholders that the sector is escalating in demand, and there is a need for supply of workers, and the EU migrants is becoming a very important contribution. That they are not directly recruited from EU, although that there's some agency recruiting, but it relies on the concept of the free mobility, and people are coming to the UK to take up this job. And what the experts felt that with the increased demand and lower supply or open free mobility, there will be increased employment of undocumented migrants. That will have implication on the local labor market, and also the local labor market will have implications. And what we've seen with the COVID and pandemic is the increase of people in the local markets, and I'll come back that to later on. And experts felt that regulations is mediating factor, and whether the current regulations are sufficient or there needs to be further regulations to ensure there is no exploitative labor market practice, and the implications on the workers and the care users are safeguarded. Right, so I did mention this undocumented thing, and the other issue that we thought from the Delphi surveys was to understand what is going to happen, what is the potential of Brexit implications on the workers' rights. In time one, which was in 2019, a large majority of nearly 80% felt that Brexit will risk weakening workers' rights. Within that, there was like 57% saying that there will be increased undocumented migrants. And in time two, when we had clearer ideas around what the new immigration system will look like, and the new points-based system, the vast majority felt that this will be particularly detrimental to home care. And when we asked them where in home care will these detrimental effects be important, the geographical disparities came out across very well. And this is because we just talked about how migrants constitute significantly in certain regions. But what was interesting as well, that 50% of respondents felt that there were particular groups that will be at higher risks, and particular types of provision will be at higher risks, and that is the live-in care. And that is quite interesting, given that historically live-in care is not a large kind of provision in the UK, unlike other European countries, for example, like Spain and Italy. So just to give you an idea about what is live-in care in the, and how does it sit within the whole UK kind of home care sector. It is quite a small, relatively small group, and it's very difficult to quantify because there is not much data around it, but it's a significant segment and it's a growing segment. In fact, more recently, it has been advertised as the best ideal alternative to residential care. And it usually targets predominantly people with high and complex needs, so people who needs kind of 24-hour attention or during the day. But live-in care is additionally emotionally and physically demanding. So we always said that social care is an emotional job. It is emotionally taxing, but live-in care in particular is furtherly kind of emotionally and physically demanding. People live within the care users' homes. They become part of their lives. They are on call 24/7, etc. And it's quite different in certain ways from other service provided in people's home. One of the main differences is to do with this share of non-regulated providers, non-CQC registered, and that is to do with the type of the contract. So basically, in a lot of these contracts, it's seen as a domestic private agreement between the user or the family and the live-in carer. So it doesn't sit within the CQC regulations in terms of training and regulation. And it also means that this type of employment and contracts can be very difficult to monitor or safeguard, because the care as well is provided within the private home and provided with these sort of agreements. Also, the role of introductory agencies and platforms is quite higher within that sector, and we find a higher rate of self-employment. And the sector itself is really reliant on migrant care workers, and that is something that we can observe from other European countries, particularly Italy. But it lends itself to attract migrant care workers, particularly circular migrants, because it facilitates the migration process to a certain extent. It comes with accommodation, and it has this atypical work patterns, like you work for several weeks and then you go off for a week, and that allows again for circular caring. So people who have caring responsibility who can travel, provide some of this, and then go back home. So within this kind of live-in care, we have to think about it. It's really an embodied nature of care labor. It is very emotionally and physically demanding, but sometimes it's not seen as work by everybody, including the clients and their families. So you're here, you're part of the family, but at the same time, you're required to provide care, to be available, all the time. So again, this kind of blurring between what is work, what is not, and the reliance on the emotions in terms of kind of nature of care work. And within this as well, gender is a key discourse when we think about it. So it attracts the majority of women, although that we see in some attraction, particularly of migrant men working with perhaps men with physical disabilities. And again, the accommodation was kind of an important aspect of it. But we have to keep the gender as a key discourse in the analysis. And I'm just going to give you some flavors of what I mean about that. Because this is blurring the nature between, is it work, is it not work, is it something that I'm a part of the family, or is it something that I have to be protected in terms of kind of labor rights. So that's someone, they told me it's not necessary to pay the minimum wage because this is kind of au pair job like, because I'm living there, eating there, watching telly. So then that is immediately kind of take it away from the thinking of work. It's something different. It sits on the boundary, and it's people acknowledge it's far away from just the companionship for the elderly person and just sitting with the ladies watching telly, where are working, and that is something really interesting. Where they work in big houses, really huge houses, and organize everything. So again, the care work becomes kind of expanded to other work, or even just walking up and down the stairs, taking time to prepare meals, cooking fresh meals, shopping, dressing them, and personal care as well. So even the definition of care work becomes kind of expanded. When you work in live-in care, you stay with the family, with this person, and if the person is capable, he talks, he knows what he wants, and what is there for assistance. So it's not an easy job, if I can say. It's an easy job for a gentleman of my age that was a migrant worker who's a man. But again, we see a lot who say that it's actually the fluctuation between one person to the other can be quite different. So this kind of narrative brings to mind straight away what are the boundaries when you do live in care for migrant workers. What is the boundaries between what is formal and informal, what is personal, what is work. And there is a lot of interrelational aspects and multiple boundaries. And it is kind of the caring the worker and cared for the employer and the place owner. So there is also kind of power and authority dimension. And you can get your clients very demanding. And what people say that with the pound of flesh of you, so they want to get out of you as much as possible and expect you to be the gardener, the cleaner, the carer, the dog walker, similar to the previous code. And again, what a lot of the relationship will depend on the type of relationship between the person receiving care and their family. So this person is saying, if the family is very nice and appreciative that we're doing well, it's a really good feeling. But if you get another sort of relationship, that can be quite be challenging. And you kind of get to know the person, so you become part of them, you eat with them, you become a family. And that is problematic when we think about it from a well-being lens, because they are not family. they are the employers and they are the people you're caring for. But it's important to keep that in mind for people doing the live-in care. So one of the other aspects, and we touched upon that, is that the reliance on usually women migrant workers, and they usually have their own caring responsibilities, and they do continue caring while they are doing the care and in between. And we have a lot of quotes and a lot of discussion in our interviews about the impact of live-in care on the relationship with families, and whether they are partners, parents, children, or grandchildren. And really a lot of discussion around the role and actual forms of intergenerational relations and care exchange within the migrant care workers family, and the importance of communication, presence, and technology. And it becomes like this is the only way to do this caring. And what the migrant workers saying, oh, we are actually lucky because we have technology, although we can debate that. Because it can be emotionally exhausted as well if there is something happening at the other end and you can't really be physically there to support, or if it becomes on the other way a way of demand, particularly money from you. So it has the two edges, but it facilitates keeping in touch with people. And we have a few people in our sample who had the ancestor visa, so they came from South Africa, perhaps on a Dutch passport, and they continue being in touch with their family, providing virtual care for a number of weeks, and then travel to their family to provide hands-on care. And we've a lot of them talked about virtual and distance relationship and how that is impacting on their partners, and how kind of things like WhatsApp and Skype allowing some of this communication to continue, but a lot of them caution that it's not always healthy and it's not always a good thing, but you try to make the best of it. So within this narrative, place becomes really important when we think about its relationship with well-being within the context of living. Place, proximity, and vulnerability. So basically, you are in a place that is not your own, but you are grateful for that place. You have to set your kind of boundaries. There is issues around authority and power, both ways, from the people who are accommodating you and kind of basically employing you, and from the live-in care worker as someone who's providing care for someone who's vulnerable. So this kind of power and authority and balance of power is quite dynamic in the context of live-in care, and there are quite a few risks of abuse and exploitations both sides. But what is additional to migrant live-in carer is this lack of social support. So a lot of studies in social care highlighted the relationship between social support and incidents of burnout or improved well-being. And social support usually comes from either formally within the employment or informally from social networks. And with live-in carers, they lack both sides. So there is no supporting networks, although some of them speak about the agency, the recruitment agencies, that sometimes they do like an outing, one-day outing, or they will be able to communicate with their peers. But this is not, kind of embedded within the nature of the work. And the replacement is really about virtual contacts. And there is a high level of social isolation. In addition to that, there is this kind of work personal boundaries. Where is your place, and where is what's individually kind of for you, and what belongs to work, when the workday starts and when it ends. And a lot of them also talked about surveillance, whether it is informal surveillance, like feeling watched, or the family actually watching them, or through cameras. So there were some people who spoke about cameras being put everywhere because the family want to make sure that the person that they look after is looked after well, or they are safe, and that kind of feeling that they're always surveyed, you don't have a personal kind of time to be on your own is critical when we think about well-being. And the other kind of point that to highlight when we think about the whole workforce is the professionalization of the live-in care workers. Do they belong to a professional workforce, or are they doing some kind of quasi work that is kind of between vocation and work, and where they sit with exploitation and being reliant, and that is very interesting element. And from the interviews, what we've seen, there might be two groups of workers. Some of them who are actually not aware of their rights. So, for example, issues around working hours, how many hours, how you calculate this, and what are your rights in terms of sick leave or holidays, etc. And they are genuinely need some support in terms of understanding the rights more. And there is another group who might know their rights, but they choose to not pursue it or accept whatever is on the table because they do need the money, they need to send remittances, and their well-being has been placed somewhere else in the well-being of their family back at home. And also within this kind of place proximity and vulnerability within the live-in care context, there are other important stakeholders in place, particularly the family member, the individual and their family, and older people's social networks themselves. So we've seen a lot of the live-in care workers saying that now I'm actually, my social network is the person's social network, but sometimes I'm not accepted. So for example, if they are invited out and she goes to accompany that person, she's asked not to enter the house of the other person, perhaps because of the color of her skin or because she doesn't fit in. So you are in, but you're out. You belong, but you don't belong, and it's a really difficult dilemma when it comes to well-being. And then this boundaries between, is that care or domestic work, and the relationship when we think about other research and literature and around domestic workers and similarities and differences. So these are just quotes to highlight in relation to this surveillance thing, and this person speaks a lot about being being watched all the time, and that was making her feel very uncomfortable, because every time, even if she knows that she's in a break and she wants to speak to her family on WhatsApp, she feels that she's actually being watched because they say that you have been not looking after him, but you're on your phone, etc. And another quote is to do with this kind of they're not having clear boundaries in this job, and it's really difficult, because they say this was through an agency. They assist you as they went along, as to have you get the personality to be able to do care. That's how she's been recruited, and it's not one size fits all. You've got different clients with different personality, but I think there are general things that if you've got in your personality, that would help. But inevitably you're going to trample over your client's feeling, over your client wishes, and this kind of placing the client's wishes beforehand and being always kind of anticipating that there will be a different client with different needs, and nobody prepares you to that, basically. So really, place becomes an environment, and live-in care becomes an important construct of well-being. If we think about, the environment in general is an important factor in relation to well-being, the space, cleanliness, comfort. But when you have constant blurred boundaries between domestic work and space, that will certainly impact your well-being. And then again, this balance of interface of work. And maybe one of the most important implications on workplace and well-being is this uncertainty of the place. So you're not sure about your next placement, and I'll show a few quotations that will make you kind of realize what I mean by that. You're not sure where you're going, how your place will look like, where is your space, etc. So people say about these kind of, how they organize this, how they make it, good to work for them. So they come over the summer because the weather, and they go back. And then there is always the kind of, you know, little things like the beddings and mattresses. Nobody think about these things, how she can be prepared for this. And it's for her, it's really kind of hard time, provide hard time, and that kind of comes up front of her. And she actually, that person talked about having a duvet and sleeping on the bed or something similar. Sorry, sleeping on the floor. So this quotation I really like, because this person have done quite a few. This is Harry Potter, of course, under the stairs. This is his room. And she said exactly that. She's been doing a lot of live-in care, and she said, well, I've got from the broom cupboard to a beautiful double bedroom. But for her, it doesn't make a difference because it's not her room. And people wander into her room, particularly she's working with people with dementia who forgets that this room once belonged to their daughter, and they come at night. A lot of people said that they are not allowed to have locks in their doors or to have ensure that they are you know, in a private space. So it doesn't matter for her. And that person talked a lot about living out of a suitcase, basically. So she ensures that she's got everything she wants. She doesn't think about the place, that this is her place, but what's her place is her suitcase. So that kind of provides you with some idea of how place can be presented, and be kind of not only presented, perceived by different people. So when we think about well-being, because we asked the interviewers to talk about their well-beings and what's impacting on their well-being, and really it's there is a lot of displacement of well-being, so it's externalized into others. So migrant live-in carers are usually women. They actually search for well-being, better well-being, in the majority for their families before themselves. And they think that accommodation is really important, but home isn't, you know, home, they think about back home. And, you know, but in reality, when we think about their well-being here, it's not really facilitated because there is no home for them. This is part of the package. And also, it's not like physical home. It is all these blurred boundaries that we talked about. What's private, what's personal, what I'm allowed to do, what I'm not allowed to do. Where is the fine line between work and personal life? The home becomes a quasi-home. It's compromised privacy. It's dependent, and there is a high level of vulnerability. And they say kind of, you know, again, this distance make problems because the long distance relationship becomes really difficult to maintain. And these workers highlighted that they become further isolated from their original home. And a lot of them spoke about strains put in their relationship, particularly with their spouse and partners. And, you know, others would think about, look, I've been doing this a lot. Why didn't I think beforehand that I can actually bring my son? If I would have brought it with me, he would have been a national by now. So again, the whole discussion is about their family, their extended family, their partners and their offspring rather than themselves. So in addition to all these kind of complexities, so we've got live-in care is an element of home care that is growing. We've got that part reliant on migrants, and we have Brexit, which is putting a lot of challenges on the supply of workers, and we have all these issues around being unregulated and potentially increasingly might be at risk and prone to undocumented kind of work with all various safeguarding and risk and exploitation matters. In addition, we've all, you know the impact of COVID, and when the pandemic hit, the real implication was seen in care homes, in residential care, for a variety of reasons. It was in the blind spot of many policy kind of development. There has been a lot of discharge from hospitals to care home. And unfortunately, we've seen that 34% of COVID death in the UK was among care home residents. And in addition to this, we've seen a lot of social distancing and lockdown measures, and that increased isolation of care home residents and their well-being. And within that kind of over a year, there has been a change in narrative in terms of care preferences and culture. So maybe, you know, people started to ask, what are the real alternatives to residential care? And some actually organizations have been actively promoting live-in care. If you just do a Google search, you'll find a lot of organizations promoting live-in care as a real alternative. And instead of going to care homes, and instead of being at certain risks, having someone in your home 24/7 would provide you with all the need that you know, or people need for complex needs. This is not situated in the discussion within what is the regulatory framework, what is the training requirement, what is the sort of safeguarding measures. In the majority, it becomes, although there are some efforts, but in the majority, it's a private arrangement between the person, the individual, their families, and the worker. COVID at the same time did something really interesting. Of course, unfortunately, a lot of people being furloughed or kind of lost their jobs, and there has been a whole campaign of volunteering, and care has become, although that it's more around NHS, but care to some extent have been seen as a vocation that people can do while they have time. They are not in employment, and we've seen some influx of employment in the sector. And that has been actually acknowledged by the Delphi survey. So 92% of respondents on the round 2 said there will be new groups of workers would be attracted to join the sector. However, they were very clear that this is in the short term. There were lots of questions around retaining this group, and also lots of questions on the implication on the workload of existing groups. And the other thing that COVID did in terms of live-in carers is a restriction, huge restriction on international travel. And if we just recall what we've seen from the interviews, a lot of these are circular migrants, so they're not actually able to come and go. And within this whole thing, we've seen a huge pressure on informal carers, so the family themselves, and actually a huge level of isolation among older people themselves. So when we asked our experts in the second round in relation to likely outcomes of the COVID pandemic, particularly for home care workforce, including the live-in care workers, and basically the more the grey and the orange, this is most likely, this is somewhat likely, and the opposite colors is most unlikely. So what they thought that would be most likely is in short term, home care will attract new applicants, particularly around volunteering, etc. But retention of these recruits will be low. And the other thing that they also acknowledge the greater pressure on home care workers because the absence, the quits, the turnover, and new entrants will not be sufficient, because new entrants might not have the same experience. They felt it very unlikely to have reforms to introduce improved working conditions, and unfortunately we're seeing this, that being the social care reforms being pushed backwards further and further. And something kind of neither likely nor likely to happen is that longer term home care will attract new applicants and retention will be similar to existing levels, so vacancies will decline. So they don't see this as something that could easily happen in the near future. So just to sum up, and in the last few minutes, that there are positive and negatives impact of live-in care. There are issues around they belong to somewhere, they have accommodation, but there is a temporality. And again, in terms of people who are receiving live-in care, there is people who can have 24/7 support, but there are issues around power, authority, safeguarding. The expectation and dependency goes two ways, but for live-in care workers, this displacement of well-being has become very apparent from the analysis, both in terms of time and also space. Now, Brexit and COVID-19 might actually make people rethink about the nature and structure of social care provision. And we expect, and the respondents to the Delphi survey expect, that live-in care will be one of the areas where it will see a growth. And the group of people that they felt will be most impacted are older people with complex needs. Then there remains a question of Brexit and migrant workers and the reliance on those who come in their own accord and try to seek employment here, and how these gaps will be filled. That is a consistent, significant proportion that the sector will continue to need. And at the moment, there is no clear other alternative. There need to be sector-wide changes, but whether it will happen, that's a big question, particularly in relation to what we've seen with the social care reforms. But really, to pick up this sector, we need better pay and better jobs. And I think there is quite an interesting discussion happening in Australia at the moment, yet the funding for these are always questionable. But in the UK, I don't think this is happening even at the discussion level. People felt the experts who responded to the survey, they wanted to see an expansion of formal services, they want to see expansion of regulation and registration to include live-in care work, and to acknowledge that live-in care work is a growing area. There is huge geographical disparities, and also the big impact on users and their informal care. So if we can't fill the gaps for migrant workers, who do we expect to shoulder this? Is it the informal carers? And well-being becomes a big question here for all parties involved, for the individuals, for the family, and for the care workers who end up particularly working in live-in care. So thank you for listening, and I'd be more than happy to continue the discussion and to answer your questions. Thanks.